Although heat pulp test is mentioned in endodontic textbooks and still taught in dental schools, experienced and master clinicians rarely use it. And that's for a good reason. In fact, in my 4R operational diagnosis protocol, heat pulp test is not even mentioned or recommended. Hello and welcome. I am Marwan Aburas. This presentation has three objectives. The first is to review the traditional methods, heat pulp testing, and their limitations. The second is to discuss the pathological effects of increasing pulp temperature on the pulp. The third is to explain my stance and why I don't use the test. Let me explain. The utilization of unmeasured heat generated by friction of rubber wheels running or the application of a hot instrument, hot softening gutta percha, hot tools, or electric heating instruments is unnecessary. It's invasive and carries unpredictable consequences to the pulp. Unfortunately, this occurs due to the lack of clarity regarding the whole subject of pulp testing. There's a conclusive evidence that 3 degrees increase in pulp temperature is safe. However, 5 degrees increase may cause inflammation, which could progress to chronic inflammation, while 10 degrees raise could lead to coagulation and necrosis of the pulp. It is prudent why one would take such a risk when CPT test is available and accurate without the false negatives, both physiologically and functionally, because of the hydrodynamic theory. Pitford and Patel in 2004 outlined the ideal features of pulp vitality testing, being able to assess the pulp blood flow, provide objective measurements, free from error, effective for healthy, heavily restored teeth, effective when the pulp chamber is reduced, quick and easy and inexpensive. Now, applying these standards clearly to HPT does not meet most of them. It fails. As endodontic clinician, again, I repeat, and dental educators, we must pay more attention to the broader context of endodontic diagnostics, especially with pulp testing. Include the patient narratives inside of the radiograph and the story of the pulp within the overall condition of the tooth. And that's exactly, again, which I am very proud about, is what I proposed in the 1980s, the stress pulp concept, which has proven itself in the cases that we see endodontic indications after aggressive invasive crown placements, up to 20% few years later, but that's the fact. Thank you for listening.